Welcome to our Careers in Mental Health Information and Q&A session. I'm Dr. Christina Connolly, Director of the Division of Psychological Services for MCPS. We are recording this event from home, and that is why you did not have face masks on for this event. I want to thank everyone for joining us to learn more about some of the different career options in the mental health field. This topic is very important due to the critical shortages of mental health professionals. The pandemic has helped the world to realize the need for more positions in mental health. Many agencies and schools are increasing the hiring of mental health staff members. For any students out there trying to determine what career they want to go into, we hope that our event tonight helps you to consider a career in mental health. This show, which is a part of our Mental Health Awareness Week, is also being co-hosted by two MCPS students. Christina and Sophia, tell us a little about yourselves.
Hi, everyone. My name is Christina DeFiore, and I am a senior at Richard Montgomery High School. I love to dance, and I'm very active in student government. Personally, I've had some mental health issues regarding my depression and anxiety, and I sought out help to manage that. That process made me value the support system out there, and I'm now considering a career in mental health. So this program is perfect for me.
Hi, I'm Sophia, and I am a junior at Quince Orchard High School. This past summer, through the Summer Rise program, I had the opportunity to intern in Dr. Connolly's office and learned so much about the role of the many people involved in student mental health. That experience confirmed for me that I wanted to pursue my studies in psychology and mental health.
That is so awesome to hear, and it was a pleasure to work with you this summer. Thank you both for being with me today to co-host. As part of this Careers in Mental Health show, we brought together 5 mental health professionals whose work supports students in schools.
So if you want to ask a question to our panelists, you can go to YouTube, search MCPS TV, where this show is streaming, join the stream, and use the YouTube chat feature. We have people monitoring the chat who will share your questions with us. We will try to get to everyone's questions and start asking them just as soon as we introduce and briefly speak with our guests.
So let's get going and introduce our panel of mental health professionals. To get us started, I would like to introduce Dr. Charles Barrett. Dr. Barrett is the coordinator of diagnostic and psychological services with Loudoun County Public Schools and a college lecturer at prestigious universities in the DC metro area. Welcome.
Good evening, everybody. Good to see you, Christina, my friend. Thank you for having me and looking forward to tonight's program.
Our next guest is Anita Garcia. Ms. Garcia is a licensed clinical social worker with Montgomery County Public Schools, working with the Restorative Justice Unit. Welcome.
Hello, everyone. It's great to be here tonight. Thank you so much for the invitation, and I also look forward to the presentation.
I am pleased to introduce Dr. Nikki Ham. Dr. Ham is the Associate Director of Clinical Training and Field Experiences for the Department of Counseling at Bowie State University. She is also the president of the Maryland School Counselor Administration and a former school counselor with MCPS. Welcome.
Thank you so much for having me. This will be fun. I'm looking forward to this discussion.
Next, I have the pleasure of introducing Reverend Leo Yates Jr. Reverend Yates is a licensed clinician specializing in vocational rehabilitation. Welcome.
Thank you so much. I'm so glad to be here with all of you.
And last but not least, I am delighted to introduce Dr. Brian Yu. Dr. Yu is a sports psychologist presently working with students and athletes at the University of Maryland College Park. Welcome to the program.
Yes, thanks for having me. I'm really excited to be here. Go Trips.
Yes, and welcome to you all, and thank you for being here to share with our student audience today. Before we go to the student questions in the YouTube chat, my student host would like to ask a few questions to learn more about your careers and your career paths. So take it away, Christina.
Here's my first question. Where did you go to college and how many years did you attend college to obtain your degree or degrees? Let's start with Dr. Barrett.
Yeah, so again, good evening. I am from New York. So I went to St. John's University in Queens, New York, majored in English and psychology. Then I went to Lehigh University in Bethlehem, Pennsylvania, earned a Master's of Education in Human Development, and also my PhD in school psychology. The PhD program was designed for 5 years, but as many people know in graduate school, sometimes things take a little longer, so it took me a lot longer than 5 years. But that's life sometimes. You keep going, you persevere. That's my journey. St. John for my undergrad, and then Lehigh for my graduate training.
That's very impressive. Thank you. Now to Ms. Garcia.
Good evening, everyone, again. So I started my college career in New York City. I'm actually a native New Yorker as well. I attended the university, the City University of New York, actually, Brooklyn College. And I got my 4-year degree there, my bachelor's in sociology. After working in the field for several years, I decided to go back to school for graduate school. I had an interest in working with immigrants, in particular newcomers to the United States. And I moved to the lower Rio Grande Valley in Texas. And so I completed my, my degree in social work, my master's of science in social work. Clinical practice with Latinos was my area of concentration. And that took me about 3 years. I did the part-time track. And then from there, I started working again in the field as a clinician. Started working on my clinical hours, which took about 3 years. So an additional 3 years to then be able to sit for my clinical licensure. And now I'm a licensed clinician as well here in the state of Maryland.
That's amazing. Thank you. Reverend Yates.
Thank you. And I'm glad to be here with all of you. The journey for my academics part started off with getting a bachelor's in business administration. I felt like was a good foundation to get me started with my next degree, which was a master's of divinity, which provides I think, a part of the pillars for pastoral counseling. When I was in the parish setting, I could see there was a need for more counseling. And since I was serving as a pastor at a deaf church, I'm fluent in sign language. I decided to go back to school and get a master's of science in clinical counseling from Bellevue University. It was after that I received my licensure here in the state of Maryland. I have an LCPC, Licensed Clinical Professional Counselor's License, and have been serving in counseling for 10 years now.
That's great. I'm currently learning sign language, so I have a lot of love for that language as well. Dr. Ham?
Yes, hi. Well, I started at University of Maryland, College Park, where I got my Bachelor's of Science in Family Studies, which is really the study of families. And so after I finished and completed my bachelor's, I went to the George Washington University, where I earned my Master's of Education in School Counseling. That was about 2.5, 3 years. And then I did postgraduate work to earn my licensure, the hours I needed, the clinical work. That was another 2 years, where I earned the hours and the experience to then apply for my license to become a licensed clinical professional counselor. And then recently I went back to school to earn my doctorate in educational leadership with a focus on counseling leadership. And that was another about 3.5, 4 years of work, including clinical experience as well.
Wow, thank you for sharing. And Dr. Yu?
Yeah, so I completed my undergraduate or my bachelor's in psychology and social behavior from the University of California in Irvine. I did my master's in clinical psychology at California State University, Fullerton, and got my PhD in counseling psychology with an emphasis in sport and performance psychology from the University of North Texas. All in all, so undergrad, I spent about 4 years in that, another 2 years in my master's program, and another 6 years in my doctorate program. My journey doesn't necessarily mean representative of how long it takes to get into this field. For a lot of people, you may not even need to do the master's program.
That is a great point. Thank you for sharing your experience. Dr. Connolly, would you like to share?
Sure. So I went to my undergrad university, was Loyola University in Maryland, and I got a degree interdisciplinary degree in biology and psychology. I was pre-med and decided not to go to medical school to not be a psychiatrist. I felt like I wanted to be a psychologist. And so then I went to graduate school in the school psychology program at James Madison University in Virginia, and then joined the combined integrated clinical counseling and school psychology program there. And so overall, my graduate years experience, I was in grad school for 5 years, including a master's degree and getting the doctorate.
That is awesome. Thank you all so much for sharing your impressive journeys. Sophia, you're up next.
For the next questions, when and why did you know you wanted a career in mental health? And how did you pick your specialty? Dr. Barrett, would you like to respond?
Sure. Thank you for the question. So I knew from high school that I wanted to be someone who worked with children, either teaching high school English or being a speech pathologist. I have a lifelong stutter. And when I was a kid, I was in speech therapy in school. But when I got to college, I changed my major to psychology and English. And by the end of undergrad, I was thinking about either clinical psychology to work with children or still becoming a teacher, working in schools. And my mentor that I worked with, Dr. Raymond D. Giuseppe, he told me about school psychology. And that was really, I guess, my confirmation that I wanted to really work in mental health and with kids. So through him, he was a clinical child and school psychologist, and he felt that school psychology was the best of both worlds, with schools, with children, education, and it kind of just brought all of my interests together. So I would say in undergrad is when I really knew that I wanted to work in mental health, but always knew from high school that it'll be with children in some sense.
Wow, how inspiring. What about you, Ms. Garcia?
Well, actually, once I graduated with my bachelor's, I started working in the field immediately in the social service sector, in particular within the child development career as a service coordinator with early childhood development. So I worked there for about 6 or 7 years. In working with families, I was exposed really to a lot of the disparities within my own community. I'm Latina, I represent the Latino community, and also people of color, and just seeing a lot of the injustices that were happening even within the early childhood education sector really led me to desire to learn more and to also want to do something about it. And so I started first my master's in early childhood special education, and then realized that I didn't see myself in a classroom setting per se. I wanted to work more one-on-one. And so from there is when I decided to go into the program at the University of Texas, again, because they had a particular program around working with Latinos specifically on the border. And so that, again, that also a lot of the work that I did in early childhood development was working with immigrant families as well, and their children. And so also not seeing a lot of representation. I didn't see a lot of myself in the professionals that I was working with. And I said, well, how are we going to bridge that gap, right? What are we going to do about it? And so again, the opportunity presented itself to me. I had a friend who was also a counselor and said, Anita, there's a great opportunity out here. Why don't you come down? And so, yeah, I took a leap of faith, and the rest is history.
Wow, that's amazing. Representation is very important. How about you, Reverend Yates?
Thank you. I would say the seeds were planted from when I was a teenager, because I was a student who had some mental health issues, and I had a school counselor who made a referral to a mental health counseling in the community, and did that for 2 years when I was in high school. Found that to be very helpful, and even at some point thought about being a therapist. But like some of the others, the journey there was kind of long before I arrived and experienced life. And when I was serving in a church, I saw the inadequate services for deaf and hard of hearing people in the community to have access to mental health therapists or social workers and so forth, and where they didn't need to have an interpreter. I was an interpreter, but I didn't want to go with them to interpret the counseling sessions. But I knew that I felt that there was a calling to go do more and learn more. And at that point, I started to look at the different disciplines within the counseling umbrella, from psychology, professional counseling or mental health counseling, clinical social work, marriage and family therapy, and pastoral counseling. All of these are licensed clinicians in some form or fashion. And I interviewed for each discipline and went with the mental health counseling because I felt I could do more in that way and be able to support the deaf community that I was a part of.
Wow, thank you for sharing. And you, Dr. Ham?
Well, very similar to Reverend Yates, and actually, as Christina bravely shared earlier, and her journey with mental wellness. I also, in my teenage years, was working with really experiencing and really advocating for myself to find ways to maintain and build on my mental wellness. So I began with therapy. Thankfully, my family really was encouraging of that. And that just it opened my eyes. I was like, whoa. You get paid to do this? And it was so transformative. I wanted to do that. And yet I didn't know how. You think I would talk to my therapist to talk about that, but I didn't. So I wound up majoring in journalism at University of Maryland, College Park. I came here. And then one of my very first assignments, I had to interview a social worker. I don't remember that. And I went and interviewed her. And I said, this is what I want to do. I want to lead. I want to do that. Maryland College Park doesn't have a social work program. So I transferred to family studies. And that began my wonderful journey and my just wonderful passion for providing mental health wellness and education for everyone. And so it started there. And my why is because I want other people and everybody to understand we focus so much on physical health, but I want us to, and even to understand we also have mental health and how important that is that we take care of that and we really invest in that and we destigmatize access and opportunities to reaching and talking with a therapist, a faith-based leader, someone to work on those mental health and wellness, the concerns and challenges that we all face. So that's my why.
Thank you for sharing your story. How about you, Dr. Connolly?
And so for me, going into psychology, so I have a grandmother who was a psychiatric nurse who worked in hospitals around the state that in segregated units and so forth, working with patients who are mentally ill, and to hear her stories talking about working with those mental health. My mother at one point was a licensed drug therapist in Baltimore City. And so I would hear her talk about her stories and those that she worked with in the substance use field. And so but then I was like, they're like, well, go be a doctor. Don't go do this. Go be a doctor. And I was like, okay, so I'll go, because I always loved working with children. And then went to college, was going through the pre-med. And I was like, I really like psychology, though. I don't know if I want to go to be a pediatrician. I just, kids coughing on you and stuff. So I was like, I don't want to go into mental health. And so, but then I was volunteering at Shepherd Pratt my junior and senior year. And so then I was like, wait a minute, there's kids here and they're like these mental health crisis state, like they're acting out and kicking and screaming and doing all these things. And I was like, I need to work earlier on. So I was talking to one of my professors. She came to me, she said, why don't you go into school psychology? Like they work, there's a specialty in psychology. They work earlier on, like in terms of, and you can do more preventative work instead of working with them when they're at this significant state at the hospital. So I said, okay. And so then I started applying and looking into school psychology and realized, look, I think that's the way that I want to go. And then I was working when I was in in graduate school, like a big focus of mine was working with like Head Start and preschool programs. And so I was really doing Child Find. And so I was really into that. And so I went into an internship. And then all of a sudden they were like, you have to do crisis response. And so they gave me a pager and said, this is where you're going to go. Like you get a page, you got to go to the school and do crisis work. You know, if somebody dies or some big incident happens, you got to go do this. And so, and that's what I did throughout my internship. Well, I also did child finding work at preschool, but I did crisis work. And so now I do, as one of my specialties areas, I do crisis work around the country. And I work with the National Association of School Psychologists. I serve on their crisis intervention and school safety committee. And we do crisis response with active assailant situations, large scale natural disasters like hurricanes, tornadoes. We work all over the country in supporting school districts. And I also do that work here at MCPS and helping to oversee our district crisis response work. So that's kind of been my journey. Kind of like I went into this like thinking like, oh, I'm not gonna do crisis stuff, and I ended up doing crisis stuff. I really love it. But really love working with schools, with students, and starting at an early age and trying to work and try to prevent mental illness. And what can we do to put good initiatives in place that promotes positive well-being?
Thank you for sharing your journey. What is the next question, Christina?
Yeah, so before we move on to the next question, Dr. Yu, could you talk about your experience with how you got into your career?
Sure. So I've always liked the idea of psychology in the sense of like being able to harness like the capabilities of our minds to the highest ability, to be able to reach our goals, to do what we want to do in our lives. And I see the mind as, you know, central to a lot of things that we do. And so for me to study psychology in general, I felt like it was like a two for one in that not only would I be building a education and a career for myself, but I would also be learning a lot about myself and learning how to improve my life, at least in the mental aspect. And my doctorate degree is in counseling psychology with an emphasis in sports psych. So the reason why pursuing counseling psychology is the counseling psych piece allows me to address mental health concerns. And then the sports psych piece allows me then to address more performance related concerns. And, you know, a lot of times with athletes or student athletes, you know, they might be coming in with a performance issue, like maybe motivation or goal setting or confidence. But a lot of times it can be tied to a mental health issue as well. So having the flexibility to address not just mental health concerns and not just sport performance concerns, but to address both has been increases the versatility of what I can do.
That's awesome that you found a way to include both of your passions into one career. Thank you for sharing. So for our next question, could everyone speak on what their job is like on a day-to-day basis? Dr. Barrett, we will start with you.
So I am trained as a school psychologist, very happy to be a school psychologist, and happy School Psychology Week to all the school psychologists out there. So I just took a new role in July as a coordinator, kind of supporting school-based psychologists and diagnosticians. But I would still say that every day is different. No 2 days are the same. I've served up to 4 schools in one day, and they were all based in the same community. So I could hit all 4 schools in one day. I could be at one school all week. It just depends on what the needs are from supporting students directly. So it could be testing, could be individual or small group counseling, could be working with families and teachers in meetings. So just a variety of things. One of my taglines is that a day without direct contact with students is wasted. So I would try my very best to have direct contact with a kid, even just informally, you know, outside at, you know, in the bus loop or on the playground at recess, cafeteria. But just a variety of things are always fulfilling, from prevention to intervention, direct service, indirect service. So love it, a lot of fun, but even now just trying to support psychologists, maybe problem solving through challenging situations. Today I got a couple calls, very, very different situations, but it's always exciting to support people who are supporting students.
That's a great tagline and a great mindset. And congratulations on your relatively new position. Mrs. Garcia, would you like to share?
Or very similar to Dr. Barrett. I work now in the Restorative Justice Unit here at MCPS. A lot of the calls that I receive really deal with disciplinary concerns, right? And behavioral concerns that come up. And so, again, similar to Dr. Barrett, I'm called out to different schools. We like to call ourselves a triage team now, where we go in, assess different situations that are happening with students, making sure that we are equitable in our practices and how we are managing behavior situations. We want to make sure that we also tackle the root causes. So as a clinical social worker, I'm able to provide a lens when I come in, a different lens when I come in to speak with an administrator or other counselors as well that are there who may not have the social work lens specifically. Just bringing ideas, bringing understanding to the situation, and also making recommendations accordingly. Can we use other options, right? Besides a suspension, what can we look at, right, within this family unit to see how we can help support this student and get them the services that they need? Most of the time, behavioral concerns are rooted in deeper issues. And I'm sure some of the panelists will talk a little bit more about that as well. So again, my job is normally to assess a situation, provide recommendations. Oftentimes, I also do one-on-one, what I also call a restorative clinic. Twice a week, I make time to meet with families at the Carver Center as well to provide more direct services. There might be families who need a little bit of extra help. Also navigating resources in the community. A lot of people, I know that we're in a host setting, an education setting, right? But we also help families to tap into their health insurance benefits as well, right? With mental health, sometimes people don't know that they have access to these services. So providing a lot of psychoeducation as well. And yeah, working directly with a lot of multidisciplinary teams. Dr. Christina Connolly providing some assistance as well with the behavioral threat assessments. And again, just providing assistance wherever I'm needed, truthfully. And I could be in 2 and 3 schools in a day. Sometimes I go back to the same school the following day. That's pretty much what my day might look like. And then I'm also in private practice. So I have some private clients as well that I see where I use some other treatment modalities, right? Like cognitive behavior therapy, some play therapy techniques, narrative therapy, talk therapy, and pretty much work with community members, mostly Latinos as well, Spanish-speaking people. Again, trying to find services in other languages is sometimes very difficult. So I'm happy to be able to assist my community.
Thank you for sharing. Your work sounds amazing. You definitely play a very impactful role in your clients' lives. Reverend Yates, would you talk about your daily life, please?
Sure. When serving at the Division of Rehabilitation Services, that's part of the MSDE, Maryland State Department of Education, where you have your K through 12, which is here, but also the division that works with persons with disabilities. When serving there, I typically do a lot of coordinating in terms of behavioral health services. I do individual counseling. I do group counseling. Behavioral health education is heavily emphasized there, where, for an example, I run a stress management in the workplace training, because quite often stress typically is a trigger for a lot of mental health disorders, where it might worsen due to stress in transitioning into the workplace or into a workforce, for example, and how to better manage that. So we do that, referrals, doing urinalyses, preparing persons to be able to pass a drug test, for example, a urinalysis for when there is a job interview and they're being hired. Besides that, I do a lot of consultation with field counselors, the DORS counselors, who are the ones who work with the individual with disabilities and providing recommendations, as well as doing some crisis counseling. I think any of us here on the panel, I'm pretty sure, have been doing some crisis counseling in our work. And it's something that's a part of the nature that we do, is being able to, for the most part, remain calm, cool, collected while we try to assess and provide interventions during these crises. I do know that I enjoy the work I do. It can be quite busy at times, probably like everybody else here, but at the same time, it always comes back to self-care and taking time to sort of unwind and to sort of just, I guess, get replenished. Each of us do it in our own way, and just for me, it's in a more of a spiritual way to help keep me grounded.
Thank you so much for sharing. It's really interesting to see how many versatile ways you can promote mental well-being. So thank you for your work. Dr. Ham, would you like to share?
Well, yes, this is so great to see. I think the common theme is that there's never one day is never the same. And that's a common theme that is extended as a school counselor. I now work at the university, but I'd love to speak on behalf of all of the over 2,000 school counselors across the state of Maryland who serve and work in all of our schools. And they are doing really comprehensive, they're implementing a comprehensive school counseling program. School counselors work with every single student that comes through the door. And that is their job, to really look at evaluating, implementing, managing a comprehensive program. I always say that part of what they do is they're looking at really removing the social emotional barriers that impede a child's ability to be academically successful, because we're in that school-based setting. So that might look like a couple of things. Like for an elementary school counselor, it may be looking at the data and really doing a comprehensive classroom guidance lessons with first graders about friendship, because the data says, oh, we got to work on some of those friendships, how to be a teddy bear friend. So they may really do and implement an impressive, comprehensive classroom guidance lesson. And then for middle school, it might be doing a social skills group where they may run a 6-week social skills group with 6th graders who are learning how to handle conflict appropriately, because conflict is going to happen. But based on their data, based on things that are happening, they say, you know what, we may need to pull this group of students and really run a social skills group. And then in high school, it will maybe some of the individual counseling that they're doing. I mean, sure, Christina, with them, and even it can be academic, but it's also, we're looking at college and career. You're making that transition, getting ready to go on to, leaving the home, and are you ready? And some of the thoughts and concerns people have around that. So it's not just academic, but now we're looking at some of that social emotional support that we're trying to provide. So the day of a school counselor is very varied. And then, of course, they're doing a lot of the collaboration and working with, because again, they work with every student. So with every student comes a community, a village, a wonderful group of people that come in that door. So when you have that one student, I always say, behind that one student, there is a whole community of people that are behind that student supporting them. So the school counselor is working with a whole community of people to support, invite. So it can be programs that they're doing, a variety of different meetings, and a lot of collaboration. But it is probably, for me, I think it's the best job out there, because you just get a chance to really get to work with wonderful, amazing young people like you.
Thank you for sharing. I've had amazing counselors over the years at my schools. And yes, I have made several visits to my current counselor about college and career readiness. Dr. Yu, would you like to share?
Yeah, definitely. So my day-to-day basis can involve a lot of things. It might involve seeing individual athletes or student athletes, maybe about 4 to 6 of them in a day. And in those sessions, we're addressing mental health concerns, or we're addressing performance issues like how to perform under nervousness, how to bounce back from mistakes. And then, like I mentioned before, it can be a mix of those things. And other things I might do group sessions or group counseling. One example is providing an injury support group. Another thing is, depending on my relationship with a certain coach, if it is a good relationship, and the coach might look upon me to provide more regular mental toughness or mental toughness training for the team. So it might be meeting with the team for anywhere from 5 minutes to 15 to 30 minutes and providing them some skills on how to address various things when it comes to their sport. And what else? Oh, another piece of my job too is, and it's kind of the fun part, is attending practices. That's a big part of our field, is trying to build rapport and reduce stigma within the teams that we work for. So being at practice, being able to say hello to the players, maybe just casually ask how they're doing, is just one of those pieces to make them feel more comfortable with me being around. And hopefully when they do feel like they need to see a sports psychologist or a counselor in general, that they would think of me. In addition to attending practices, I also attend games. And it can vary depending on what your specific role is. So for example, my specific role at the University of Maryland is to work with their football team. So I have one team to focus on, and with football being about 120 student athletes, it's a big group to work on. But for a lot of sports psychologists in other areas, they may be the main sports psychologist for the entire athletic department. So they have a lot more teams they oversee. So they're definitely not going to be able to like go to every game or every practice. But I think that kind of sums it up.
That's awesome. And it's definitely a big plus that you get to attend the practices and games. That's very cool. Sophia, would you like to add a next question?
In a few words, what do you love about your job? And what are some of the challenges that you experience? Dr. Barrett, would you like to share?
Very, very simple. Another tagline, it's always about the children. Every single day, always about the children. That's the best part. That's the most fun. The most challenging by far is that there's never enough time. So Christina mentioned, the shortages in mental health providers, certainly school psychology shortages across the country. So I tell my students in grad school that there's one of the biggest frustrations is that there's always another family to call back, another teacher to follow up with, another email to send, and you can't get to it all every day. So at some point, you just have to stop and then try again tomorrow to finish up some things. But the kids are the best part. I often say as well that, and this is not meant to be, pejorative at all against adults, but in many ways, the children are fine. And some of our work is really focusing on the big kids around the kids. So it could be teachers sometimes, it could be parents and families, helping them to understand their students' needs or children's needs and responding, more appropriately, being more supportive. But yeah, time is certainly the one thing that we don't have enough of to really do all that we want to do for children. So kids are the best part. The most frustrating, certainly, just not having enough resources and time to get to everyone we want to.
Thank you for being so dedicated to your job. What about you, Ms. Garcia?
So truthfully, I think being able to see the changes happen, because truthfully, people come in, students, families, with so many different concerns, so many different stressors, and oftentimes not being able to really focus in and zoom in on their strengths, right? So being able, again, social work is a strength-based practice. Like we really focus in and zoom in on the strengths that people have. They have overcome many different challenges, and sometimes in the moment they're forgetting, right, how powerful they really are to change their circumstances. So when I see people starting to tap into those strengths, and it's almost like they get these aha moments. Oh, yeah, they start to make those connections, and you start to see the changes happen gradually sometimes. But I think that is the most fulfilling part for me, when I get the emails from someone who maybe didn't finish high school, eventually came back, went back to school and got their GED, decided to go to college. When I get those emails, that's really, really fulfilling for me. Just knowing that the work that we do really counts. And again, as Sophia said before, representation matters. And so when I'm working with a lot of students, who identify as a person of color or Latino, and they hear the experiences, right? When sometimes we use self-disclosure, right? When we need to, just to really connect, right? And say, I've also been there, right? I've been the high school student who needed help navigating, what I wanted to do with my life later. So really seeing those changes happen is the most fulfilling part of my job, even if it's one kid, even if it's one student, one client. The challenges, there are many challenges in this job. I think one of them, really have to do with taking care of yourself as well. I know Dr. Ham mentioned this, as well as Reverend Yates. Self-care is really important, and taking time for yourself. Being able to sort of debrief, right, from your day, take some deep breaths, practice mindfulness, because oftentimes it can be very stressful. And that's really the reality, right? It's not negative, but it's something that's a reality of the situation. So really taking care of yourself is important. And yeah, I think that's what I try to do every day to make sure that I can still be well. I can't help anyone else unless I'm well too. So that's what I always tell myself.
Thank you for sharing. And you are right. Self-care is extremely important for everyone. And it's important to take care of yourself in order to help others. So thank you for sharing. What about you, Reverend Yates?
Thank you. There's lots of joys that I have from the job that I do, but I think part of it is because I feel like it's a calling. There's this intuition that I want to help, and so I come from that place. So that's one of the first joys, I think. I think also because I'm bilingual, kind of like Ms. Garcia and anyone else, perhaps I enjoy working with different populations, being able to sign in my native language with other deaf people, seeing their achievements or accomplishments, kind of similar to what Ms. Garcia was mentioning, is always gratifying. And I would say in terms of challenges, insurance it can be a challenge. I know some of you all may not be in that having to, but the insurance part, trying to match up treatment providers based on insurance and so forth, or the lack of not having insurance, and trying to help the person to get insurance and be qualified for it. Another one would certainly be treatment providers not providing sign language interpreters or some sort of accommodations, and either finding reasons or excuses to not have to provide the interpreter or not accept the individual for treatment. Some finding a way around it, because having interpreters can be expensive, but when there's grants in place in the state of Maryland, there should be no reason why an individual can't go into, say, for example, residential treatment for drugs or alcohol when the grant is there and available. So I would say those are two of the challenges.
Thank you for sharing. Making sure that everyone has access to these resources is extremely important, and making sure that we focus on inclusion is a big part of creating a safe place for everyone to have access to mental health support. What about you, Dr. Ham?
Yeah, I concur with what you just said, Sophia. Inclusion is essential, and that we create a space where people feel that they are valued and that they are welcome. I think for me, the thing, and Dr. Barrett took it, which is working with the students. That is the part that I love. And even now, working at the university, I love working with our students. I enjoy it. It brings purpose. Like Reverend Yates said, I feel like it's my calling, and doing what I do. And don't tell my employer, but I probably would do it and not even get paid. That's how much I love what I did as a school counselor and what I still do, is that if I won $1 million or whatever, I would still come in. I would probably change the hours a little bit, but I would still come in and do that work because it's so fulfilling to me. I'm working with the students, making those connections, working with the families, all of that. I think the biggest challenge is what we're probably seeing right now and why you're hosting this is really we have a growing need for mental health providers and not enough people coming into the field. And so that is the challenge. I see it impacting the counselors that I represent. So, I just actually came off of a meeting where a school counselor is down 2 school counselors at a high school. And that's huge. Like that means that her department is now, which was 8, is now 6 people. And that's really means that there is services that students don't have access to complete because they have fewer school counselors. And we see it in mental health as well. They're mental health providers. So, that is probably the biggest challenge I see right now. So we need you ladies and other people out there, humans that are out there that are interested in this field. Come on, you can do this. This would be great work that if you have this passion, we need you.
Thank you for being so passionate about your job. What about you, Dr. Yu?
I think the most satisfying part about my job is just being able to see people excel at their highest levels, being able to see people reach their goals and things that they dreamed about. I think another nice aspect is just being a part of a sport organization, being able to be there and relish in their successes while also being there to feel their heartache and their pain and their loss. And certainly it sucks to feel those things, but at the same time, it's an exciting dimension of the work that I do. And I think another piece too that you may not get in traditional counseling is, oftentimes in traditional counseling, you meet with your client one-on-one and then they go off into the world and you don't get to see them do what they said they were going to do. They come back and they tell you about it. But in sports, the nice thing about it is I can work with someone in the therapy room and then I get to see them, out on the field, doing things that we talked about. So that's another satisfying, gratifying thing. As far as things that are the most challenging, as much as it's a benefit to be embedded within an organization, it's still an uphill battle, sometimes battling stigma, especially with athletes. And I think there's a lot of this mindset of I need to be mentally tough, and being mentally tough means I need to handle this on my own. I don't talk about this. I'm going to be judged if I do express difficulties. So that's always challenging. Another aspect too is, again, it's great to be part of an embedded organization and to be viewed as one of the team. But that does mean it gets into gray areas or difficulties with coaches and staff sometimes wanting to know more information from the individual students or student athletes. And so it can be really difficult sometimes to protect the confidentiality and trust of my clients while still trying to build trust and rapport with coaches and staff. And sometimes they just don't simply align, and somebody is just not going to be happy. So it is a balancing game of pleasing everyone in the organization. And and I haven't heard this from anyone else, but I'm sure this is not a fun part, but the paperwork and the charting. That's I remember when I first started doing this work, and I knew there was always you had to chart and you had to write notes of your cases, but I just didn't realize how unfun that would be. It's not a big deal. You learn to get around it. But yeah, just know that is a decent chunk of what you're going to be doing is charting and writing notes.
Thank you for sharing. And it is really important that we focus on breaking the stigma around mental health. Yeah. Christina, would you like to continue?
Yes, thank you. This is so interesting to learn about all of your careers. Thank you guys all so much for sharing. I just want to take this time to make sure our students watching know about Road Trip Nation. Road Trip Nation is a site where you can learn about all kinds of careers, including careers in mental health. Simply log into your Naviance account, go to careers, and go to the Road Trip Nation tab.
Road Trip Nation is a great place to see short videos about people talking about careers, like the folks with us today. Students should definitely check it out.
Yes, indeed. And that is a great resource for our students. So, okay, so let's transition to our question and answer section of this program. So members of my team have been forwarding to us questions that students have been asking in the YouTube chat. If you'd like to submit a question, go to the MCPS TV YouTube channel, join the show, and use the chat feature. And so I'm going to start with the first question. So for our panel, so what can students do to get involved or start to explore careers in mental health while still in high school? Anyone on the panel can jump in.
I guess I'll start. Oh, go ahead, Dr. Ham.
Oh, no, I was just going to say, I mean, start with your high school. If you have a club, a peer mediation, if you have a sources of strength, if that's a program that you have in your school, look out for those programs. They're out there. There are community supports that are out there, even peer tutoring. Those are places because you're in the helping profession. So look there. So I think those are great places to start. At least that's where I started.
And I would add to that, talk to your school psychologist, talk to your school counselor, talk to your school social worker. The benefit of living in this area in the DMV, Montgomery County schools, is that they are well-resourced schools that have access to a variety of professions. So they are lovely people, I'm sure. They want to answer your questions, and they can tell you their stories and their past for how they were in high school at one time and how they got to where they are. So certainly take advantage of the people that are serving in your schools every day.
I was going to add, YouTube is just a wonder these days. And if you wanted to learn more about it, there's going to be so many different options to look at across different fields and such. That would be another way to sort of explore your interest further.
Okay, so our next question is for Dr. Yu. What can we do to become a sports psychologist?
Yeah, so there are two routes. Well, yeah, I guess there's two routes for sports psychology. There's a route of focusing more on counseling, my route, focusing on counseling psychology and then specializing counseling psychology or clinical psychology, and then specializing in sport and performance psychology. And then there's another route of going through like the schools of kinesiology and studying programs that are called sports psychology or sport and exercise psychology. And going that route through the school of kinesiology, that will allow you to be able to become a consultant that can address performance concerns. But you won't be able to address the mental health concerns. And so if you go the route that I went, you can learn to not only address performance concerns, but also mental health concerns. And as far as like the degree types, you can certainly get by with a master's degree. You don't need to go for the doctorate, but certainly if you do have the doctorate, like some organizations might look at that a little bit more highly. You might be more considered for leadership positions if you have the doctorate. Yeah, sounds good.
Thank you so much for sharing. A student asked, what kind of jobs are out there for people who are interested in psychology, but more of a research way rather than speaking directly to someone? Would anyone like to answer this question?
I can share if no one is jumping in real quick. So in the psychology field, there are different types of psychologists that are out there. So there are those who go and work with students or families or adults in the field, but also researchers. So one of the things when I decided, I told my parents I wasn't going to medical school and over Thanksgiving dinner and freaked them out. And then they were like, well, what are you going to do? And I was like, I don't know. I like research. I like working with people. I don't know. And so I started interviewing and there are different ways. So each of the different types of graduate programs have different emphasis. And so one of the things I did, because I still want to work with kids, but I was like doing research. And so I looked into like developmental psychology, and that's a field that is primarily research based. They work at a university, they do research, they don't see clients. And so as you go and you look at the different areas of psychology, there are psychologists who work with testing and measurement, who go and do all this advanced studies and statistics, and they work for like corporations that do like SATs and statewide testing and stuff like that. Like there are psychologists that do that. There are social psychologists and cognitive psychologists, and they're just all different things within the psychology field. And so as you look at the different graduate programs that are there, you can decide, well, do you want to go and do like the research side of it? Do you want to go or do like work in the field and do it? There are also those who work at universities as like professors in certain programs. So like a Dr. Ham, who works at a university, works with is a trainer of professionals, but then also may do research. So I have a lot of colleagues with me at NASP who work at a university, and I think on my mind like Dr. Jemison and Dr. Nickerson. They work at universities and they conduct research, and they also work with helping to raise up the next group of mental health professionals in school psychology. So there are different ways of doing it, different paths that you can go on. But there's always a need for more university trainers, because then that can help to open up more students who then go into those programs. So there's a lot of things. And I would say for students, high school students, you can go and do some research in terms of what are some of these areas. When you're at your university, if you want to go to college, then go to your psych department and see, because a lot of times the professors in the psychology department, they are also one of the ones doing research, because that's why they work at the university. And kind of talk to them and see, like, what are some of the things you do? What are the areas like the research or potentially internships or summer initiatives? There are lots of things that you can do to try to look for in terms of trying to decide what is it that you like to do.
I would probably just to piggyback on to what she just said, which was excellent. From my experience working before at University of Maryland at the Department of Psychiatry, we definitely had lots of researchers in the hospitals and universities that are connected. And there's many of them out there like Johns Hopkins, University of Maryland, and so forth. Those hospitals connected with universities often will have departments that are focusing on research. So meaning there's usually going to be jobs available for that. Even then when one research ends, people are now working on the next research project. It's such an important part of the field that probably doesn't get enough credit. So I'm glad Dr. Connolly mentioned it, was talking about it.
All right. So our next question from the YouTube chat participants wanted to know if any of you have ever done work with individuals with eating disorders, and if so, how do you do that? So, and also wondering what other kinds of disorders or disabilities do you work with in your jobs?
I'll chime in. As school counselors, as I said, we work with every student. So certainly as a school counselor, I've worked with students that are, working with and working through and identifying either different stages in eating disorder. And a lot of times I then began to collaborate with my school psychologist and also outside therapists. That's typically what I would do as a school counselor, is really then bring in the additional support, because with school counselors, because we work with so many different students, and sometimes it would be helpful because that's not a specialty that I work in that area. So a lot of times I would then want to what we call refer out and refer to a different additional support. But the kicker is, and this is why it's so important to have that wonderful collaborative relationship, is because a lot of times then working with that mental health professional, maybe that they see an outside, now maybe a school-based mental health professional, they would say, okay, well, Nikki, now that the student is coming back, these are some things that we want to suggest. And so I could coordinate with teachers, I coordinate with administration to then provide support for the student when they're in school. And then it's what we call wraparound support. And so that's where, and then when they were saying, school counselors work with everyone. So there are a variety of different students who come in with so many different experiences, so many different challenges. And I think that's one of the things that I love and why I love being a school counselor. You get an opportunity to work with every human and all of their experiences.
I think in clinical social work as well, there's so many opportunities to work with many different challenges, right? People dealing with several different challenges. And a lot of times we see what we call co-occurring disorders, which means that you could have a young person struggling with depression and then also struggling with a substance use disorder. And oftentimes the substance use disorder is related to the depression in some way, shape, or form. Somebody might be trying to numb, right? A lot of the feelings that they might be undergoing with, let's just say, a substance, right? And so trying to figure out which one of those maybe to tackle first, or if we also, depending on the level, right, of severity, somebody may need a detox program first, right, before we actually work on the depression piece. And it can take some time. There are other programs that have both, right? So they're tackling, again, both. Somebody may need to be hospitalized, right? And medically detox. So there's a lot of different things, where social workers come in to work at each different level of care. And it really just depends on where you're working, whether that's a psych hospital, whether that's in private practice. Again, as Dr. Ham said, working with other providers in the community and setting up those wraparound services. But there's so many things that come up. Sometimes bipolar disorders, schizophrenia, those are disorders that may require a higher level of care or medication. So being familiar as a clinical social worker, you have to be very familiar with medications. There's a course that you take, although I do not prescribe medication. I work closely with psychiatrists and I'm familiar with the types of medication, right? There's been moments where I see a medication, and not to say that I'm going to question a doctor's understanding, right? But I can maybe, mention another medication that another one of my clients has used and it worked, right? And so kind of just giving that perspective, kind of having ideas of what's been used in the past, what has worked, and just bringing up those things. I've also learned so much from psychiatrists working with them. I didn't know that someone with diabetes could present with hallucinations. That was something very new. And it wasn't that the person had a mental health disorder, but that they had diabetes, right? Or they were experiencing a urinary tract infection that also caused this. So these are really important things that sometimes overlap and we may not know, right? So again, I think what I love about social work as well is that there's just it's so diverse. You can pretty much work anywhere because the needs are so wide. So yeah, I kind of went off on a tangent just a little bit, but.
I think I'll add some thoughts too. When it comes to working with eating disorders, one of the main things is working as part of a multidisciplinary team. So, as the psychologist or the counselor, you're not going to be necessarily the only one that can address this. So you're working with dietitians and maybe a physician, maybe a psychiatrist as well. And so every person has a role on treating that particular client with eating disorders. And as far as the psychology piece of how I might work with someone with eating disorders, I think part of it is changing the client's relationship with food. It's often a very adversarial relationship with food. There's junk foods, there's bad foods, there's unhealthy foods. And so being able to learn to appreciate all foods and to let go of a label this is a bad food. Sure, chocolate cake, if you eat chocolate cake all day, it's probably not going to be the best thing for you. But chocolate cake in of itself is not necessarily a bad food. One thing I like that I've heard before is that instead of viewing something as junk food, being able to view it as it's play food. We all are allowed to play and have fun, and that goes with food too. So it doesn't necessarily mean we have to stringently restrict ourselves from eating certain types of food. Another piece of the work is learning to value your body in a different way, let go of what people call the appearance ideal, not to say that appearance doesn't matter. I know for a lot of people it's hard to let that go, but trying to do your best to let go of that aesthetic, or that aesthetics is the the only thing that you can value in your body, being able to value your body for what it does for you, like how it allows you to exercise and to move and be able to talk to people. And then I guess one other final point is another piece of work is teaching clients how to tolerate distress. A lot of times, eating disorder behaviors can be done with the purpose of trying to shape their bodies in certain ways. But a lot of times it's done because it's a good way, or not, I don't say a good way, but it feels like a coping strategy. It's a way for someone to gain control in their lives when maybe they don't have that control. So teaching them how to tolerate distress and other ways to cope can be part of the work.
I found, just to add on, that for some people, because it's going to be for different reasons, but for some people, it kind of reminds me of Sigmund Freud, when he's talking about that oral fixation. I don't think that's the correct word, but the need to basically cope with whatever anxieties they have. Oftentimes when it comes to substance abuse, or eating, or any other type of behavioral addictions, we tend to want to self-medicate behaviorally. And just as Dr. Yu was mentioning, eating is one way. That's why, for example, if a person actually quits smoking, for many people, they then go and gain 25 pounds. Because we took away the one coping and went to something else. But that's telling you that there are some inner wounds that haven't been healed. And so they're looking for different ways for how to cope. So if you address it, you really got to also address the inner wounds that are there.
For our next question, the next question is, do I need to go to college to have a career in mental health? And are there any apprenticeships programs or something that I could participate in?
First part is yes, you need to go to college. That's probably the easiest question we had. Well, one of the easy ones for tonight. It's absolutely necessary to go to college to have a career mental health. Everyone on this panel tonight has what we call a graduate degree, so at least a master's degree. So more school after college. You'll find that for a degree like psychology, for example, going to Bowie or University of Maryland or Loyola, wherever you went for undergrad, getting a degree in psychology, it's almost like going to high school. It's a very broad degree, but you can't do a whole lot with that as far as specializing in mental health. So you have to specialize and get at least a graduate degree, a master's or a doctorate, in order to really work in the field. As far as apprenticeships, that's a great question. And I will just speak for school psychology, because a lot of what we do is focused on, serving students and families. Dr. Yu mentioned confidentiality. It's hard to have, students, undergraduate students kind of involved in that, shadowing and observing, just to really protect client privacy. When you're in graduate school, it's a lot different. You have what you call practicum. So you're kind of in a setting, maybe one day a week or twice a week, and then internship where you're in that setting, full time. So yes, you have to go to college for sure. And then graduate school, as far as the opportunities for apprenticeships, that's probably something, again, in school psychology, that you have to wait for until you're, in a graduate program. But I would always encourage students to, work for like a YMCA, volunteer at a camp. When I was in college, I went to work at a camp that my church operated in upstate New York. And that also just reinforced that I had to work with kids. Spent 7 weeks there my freshman year in college, and it was really great. So you can get different experiences just being around the population that you want to serve in different ways, even babysitting. Just any kid if it is children that's your focus, any kid that's not like your sibling or your cousin, to kind of just get a feel for, do you like working with children or being around children? And then the more formalized apprenticeships, internship, practicum, you'll get that in graduate school.
I will also share with regards to that, there are also programs, for example, like psychiatric rehabilitation programs, where young people starting off in the career can actually start to work and get jobs. So essentially, with a high school diploma and some volunteer experience while you're in high school, maybe working with children, having volunteered at a hospital. It really just depends on your level of experience with volunteer work, but they will hire you. And again, this may not be a career track, but an opportunity for you to learn. A lot of high school students after high school decide that they want to work for a little while, and that's okay too, really depending on where they are. That could be an option to be a direct care service staff within a psychiatric rehabilitation program. And there's also opportunities to be, let's say, a psych tech within a hospital. Many people who become psych techs after high school may go to community college and obtain a certification in medical assisting and so forth, with a specialization in some psychiatric work as well, which will give them, it'll give you an opportunity to kind of learn a little bit more if this is what you do want to do going forward, right? So I just thought I'd share that as well. I actually went to a vocational high school growing up, and those experiences were wonderful for me.
I'll add to that. I agree with Dr. Barrett in that there's unfortunately not really a lot of apprenticeships you can do when if you're not going to an undergrad institution. But if you are going to an undergrad institution, some things I would recommend that you be on the lookout for is one, the counseling center or the health center usually has, they utilize peer educators. And these are students who learn about specific topics of how to promote either physical health or mental health. So, topics could be like on, how to live with roommates or how to deal with stress. And so it's a great time. It's a great opportunity to work with some of the psychologists there, and then to provide psychoeducational workshops to the student community. And the other thing I want to be on the lookout for is consider getting involved in a psychology research lab or some other mental health social work research lab. Going into grad school is probably a big piece of how we got our careers, and grad school oftentimes is going to involve, even if you don't want to do research in your actual career, which is kind of my thing, you're probably gonna have to do it in grad school. So I know a lot of grad programs will look more highly on an undergraduate who has spent, maybe 2 years working in a research lab.
Thank you so much. Our next question is going to hopefully clear up some confusion about the different types of careers. So it's a multi-part question. It says, is there a difference between clinical psychology and school psychology? And then to follow that, what is the difference between a social worker, a psychologist, and a psychiatrist? So Dr. Barrett, would you like to start for this question?
I would love to. Yes, there are differences, but I want to be very clear. Although there are differences, we are not in competition. We all have different skill sets. We all have different strengths, and we work together. And I know a few people have said this already, that we have multidisciplinary teams, meaning that we have different disciplines, different areas of focus, and we come together. No one has the monopoly on understanding people or children, by themselves. So I'll start, then others will chime in as well. So the main difference between school psychology and I would say clinical psychology would be the focus on, in school psych, it's really about the school setting being the hub of services. So what can we provide to students in school? How do we understand learning? How do we understand disabilities for special education? So things like dyslexia and autism and ADHD. Another major focus of school psych that's also in clinical, but we tend to really specialize in assessment. So how do we evaluate students or people, well, children who may be experiencing learning difficulties, social skills, depression, anxiety. Again, clinical psych does that as well, but our focus is really on child development, schools being the vehicle to provide services, schools being the hub of those services, and then really the impact of these conditions on a student's learning. Of course, school counseling and social work, those are all multidisciplinary, other mental health professions. Again, the main difference that I would say, and certainly others can chime in, is that the other disciplines of social work and school counseling typically don't do as much assessment or evaluation, IQ testing, other things for disabilities. But we all do the counseling, we all do the groups and social skills and anger management, coping skills. But those are some big ideas that I can share with you.
Absolutely. Thank you, Dr. Barrett. And I think there was a question also in terms of a psychiatrist. What was the difference between a psychiatrist? And often in my community, people address me as a doctor. In other cultures, they assume, right? So you're licensed, they think that you're a doctor. And I make that very clear. I am not a doctor. A psychiatrist is a medical doctor, trained in medicine, trained in psychiatry, and they have the ability to prescribe medication. So that is one of the major differences between a social worker and a psychiatrist. So really, you find them working hand in hand. As I shared before, the psychiatrist may see the client, and then the client or student, whoever that might be, will then meet with the clinical social worker, who then helps the client with managing their emotions or managing their symptoms, making sure that they are taking their medication, reporting any kinds of side effects from the medication, right? And again, providing that feedback to the psychiatrist. So that's a major difference. And yes, what Dr. Barrett said as well, where psychologists really focus in on assessments, we tend to do more of the practice of the modalities and providing therapeutic techniques with clients and students.
I think I'd also like to add to echoing Dr. Barrett in that, having a doctorate doesn't necessarily mean you are a better clinician than someone with a master's degree. You're coming in with different experiences, and vice versa. And for example, like at university counseling centers, like some university counseling centers employ both those with a master's degree and those with a doctorate degree. And a lot of times, honestly, you're doing the same work. So I do, as much as like we can't control like how people might view those two degrees, and they might view someone with a doctorate with more expertise. But yeah, I just want to echo that it doesn't necessarily mean that. And if anything, sometimes someone with a master's degree can be a way better clinician than someone with a doctorate.
I think a lot of people pursuing their doctorate as well, not all, but they want to be involved in academia, right? So many people with their PhDs are able to then secure full-time employment at a university, right? To be full-time faculty. And that is a requirement for that as well. So if you're interested in teaching, right, at the college level, university level, then definitely the PhD route is the way to go.
All right, thank you all. So our next question is, so what are the salary ranges for mental health professionals? So, kids, like, they're trying to find a job. They're like, okay, that's nice, but what does it pay?
It depends. Depends on where you live. It depends on your discipline. I always say to students that you may not be a millionaire in school psych or mental health, but you can have a comfortable life. You can have a nice house, nice car, take care of your family and go on vacation. But there's a wide range of factors that go into that. But you can make good money, I'll say.
Dr. Barrett, you always are taking I was just going to say, it really does depend. Because I think in this area, in the Washington, D.C. area, it may look different. If you work in a public school setting as opposed to private practice, maybe here's the other thing too. Some of you may be business owners. I see, young adults who are doing some wonderful creative things. People go into private practice and then they're able to do consulting. They're able to do, you can really create your own business within practice, within counseling, and do some wonderful things. And that may make a different revenue stream. So I think it really just depends on what you want to do, where you want to work. But as Dr. Barrett said, you can be very comfortable and also feel really fulfilled. But again, you may not want to listen to me because I also said I would do this for free. So
I can give some stats for earnings in Maryland for social workers. So we'll start at the bachelor's level because you can actually be a social worker with a bachelor's degree. There is a bachelor level licensure that you can obtain, so you don't have to wait until you get that master's, although we really encourage it. But again, it's a starting point, and that salary can start as low as $28,000, but it can also be as high as $45,000 with your bachelor's degree. Usually the median salary for a social worker who is licensed. Again, there's also two different licensures that you can get as a social worker. There's a generalist license, and then there's a clinical license. So really the difference in that is that a clinical social worker has the permission, if you will, to diagnose a mental health disorder, again, after the 3 years of clinical experience. So starting pay with a generalist license could be anywhere from $50,000 to $55,000. And then once you have your master's with your clinical licensure, the starting salary can start anywhere at 55 and go up to about 70,000. So again, depending, and really the DMV area is one of the highest paid areas for social work. And then top pay with either your DSW or possibly working, DSW is a doctorate in social work, or working for a government agency like, the feds, you're working for the U.S. Department of Health, et cetera. Top pay can be $150,000, $160,000 for a clinical social worker. So it really, again, just depends. And then private practice, you're able to bill insurance. And I will say this, clinical social workers are the only mental health professional besides a psychiatrist that is able to work with the elderly population, which means people who have Medicare. After retirement age, the age of 65, if you're interested in working in geriatrics, it's the only mental health professional that is reimbursed by insurance to work with the elderly.
I'll add to, at least with sports psych, like a range that I Googled is for sports psychologists can be from 60 to 80,000 for a starting salary. But as you know, and at the high end, the salary has been known to be maybe as high as like 170,000. So again, with Dr. Barrett's comment, there's a lot of things that vary, including cost of living, where you're living. Some other things to keep in mind too, as just a general counseling or clinical psychologist, some places that pay a little bit more are hospitals, the VA hospitals, Veteran Affairs, and the military.
I was just going to add for licensed clinical professional counselors, LCPC is very similar to the LCSWC in terms of the entry level. I know, and I'll just self-disclose from when I was at University of Maryland Hospital, I started off with my LGSW, licensed graduate professional counseling, which is equivalent to an LMSW. We both made the same salaries, and I started off at $55,000. And when I achieved my LCS I didn't get an LCSW. I got an LCPC, and I started there when I was able to achieve it at 65,000 starting. But it's a lot of work. Just know that it's a lot of work, probably like most of us. But if you continue to do it, many therapists will continue to work towards getting their clinical supervision. It's not a special license per se, but it's another way of, if you're wanting to work with those coming into the field, and another way of earning even more.
Well, and just real quick, because I know we're almost at the end of our show. And I know I'm thinking of like school psychologists here in Montgomery County. For those of you may want to go, maybe come back and work for us, one day in the future. And so I know like our school psychologists, depending on if they come in with their an EDS, which is like a year beyond just a regular master's degree, they may come in at maybe like 55, 65,000, depending on if they have that or if they have their doctorate. And then also going up to, we have school psychologists on the final range around like 130, 140, 150, depending on how many years of experience they have working MCPS and whether they're 10 or 12 months. Now, I would say when we're thinking about benefits, because remember, it's about salary, but it's also about benefits. So, what is your health care like? Do you have your summers off? That's one thing with school psychologists. We have school psychologists and like counselors and so forth that have their summers off. So, that goes into the thinking around your pay, and because it's not just, the salary alone, but what are the other things? Like we have a lot of school psychologists who have young families and they like having their summers off so they can go and be with their kids during the summer. So there are a lot of reasons why we go and we work in schools, work in the community. You got to go and you start looking for that right job, asking these different questions around what are the things that are in place for this, and like what are the benefits that are there, the salary, other perks that may be there, and so forth. So there are, and even like now, I know there's some places who maybe give a stipend. Like for us, we give a stipend if you have your national certification in school psychology or so forth. Now, as we're going this, we have like 4 minutes left. So just real quick, I know, Sophia, if you want to go and now it says go to the last thing. If you want to, and since we're out of time, we're running out of time. One final question. And so for our folks, we'll start with Dr. Barrett first, real quick in like 5 seconds. Okay. So what advice would you give to students who are considering a career in mental health?
Make sure you like people and are okay with listening more than speaking.
All right. Ms. Garcia.
I would say to explore yourself. Definitely, we really focus on self-awareness. And so really understanding yourself and learning more about who you are will make you much more sensitive to understanding others, much more receptive as well. So I would say doing some work on yourself. If you haven't been to therapy, maybe going, right? And experiencing what that might be like. I say that everyone should have a therapist at some point or another in their life, especially if you are a therapist. Therapists should have therapists. So that's definitely something to consider. Self-awareness.
Mm-hmm. All right. Reverend Yates, 5 seconds.
I'll be quick. I would say it's important to have compassion for this sort of work. And also you're going to need some patience because change can be slow for a lot of people.
All right. Dr. Ham, 5 seconds.
Just talk to a counselor. You have within Montgomery County, there's some wonderful mental health professionals that are there. Talk to them.
All right. Dr. Yu.
As you probably have seen, this field is very broad. So know that there's a lot of options of what you can do, so explore them.
All right. So I know I'm afraid that is all the time that we have today for our show, panelists. So this was just an amazing opportunity for our students. I want to thank you for sharing all of your great answers and insights. It was a pleasure and great honor to have you with us today. And big thanks to my student co-hosts. And so closing thoughts, Christina.
Yes, thank you all so much for being here. I learned so much. I never knew how versatile the mental health field was. I knew it was very diverse, but not as much as you all expressed tonight. So thank you all so much. It was a pleasure to be here with you.
Thank you. And Sophia.
You're
love
muted.
hearing all the responses and questions. Thank you everyone for being here and taking the time out of your day. And I had a lot of fun.
All right, so thank you both for sharing. But before we sign off, viewers, please take the time to fill out the evaluation form. You can scan this QR code and use the bit.ly address to find that survey. And don't forget to check out our Mental Health Awareness Week website, where you can watch a variety of videos about mental health and participate in the Mental Health Resource Fair on Saturday, November 13th from noon to 1:30 p.m. This virtual fair will feature a variety of resources from local agencies and organizations to help support your mental health. Also, please check out our Be Well 365 website, which is loaded with information and ways to find the supports that you need. And students can also earn their SSL hours for watching and reflecting about this program, as well as other video programs on the Mental Health Awareness Week website. So students, make sure you fill out and submit your SSL form. And so again, I want to thank my co-hosts, Christina and Sophia, all of the people behind the scenes, and our panelists for your time with us today. And for those students watching, thank you for tuning in, and remember to follow your dreams and career paths. Stay safe and be well. Bye-bye.